for those of you that may be suffering from a hiatal hernia, chiropractic is definitely an option, a non-surgical option that you would absolutely want to try before you even thought about doing any kind of surgical procedure. Okay, today we have someone here with a hiatal hernia, and she actually didn't even know that chiropractors can help with hiatal hernias. So, for those of you that may be suffering from a hiatal hernia, chiropractic is definitely an option, a non-surgical option that you would absolutely want to try before you even thought about doing any kind of surgical procedure. Okay, she's got a little bit of hyperkyphosis here, as you can see, rounded back. We're supposed to have a kyphosis here, but hers is a little bit too much. Okay, so I gave her some stretches to do on her first visit over a foam roller, and we're going to work on that posture right through here. And she also has plantar fasciitis. For those of you that don't know what that is pain on the bottom of the foot. Now, a lot of times it's misdiagnosed coming from the back, pinched nerve. In this situation for her, it's plantar fasciitis. We did a foot scan, a 3D foot scan, a laser foot scan, to detect the three arches in the foot, the medial, the lateral, and the transverse arch. And we saw that she had two of the three arches flattened. One was completely flattened, the other one was about 50% of the way there. So that's why she's having some pain more to the outside here. Yeah, and I'm going to show you her scan. And in her scan, you could see the lateral arch is red on her foot scan. So she's having pain here because she's putting most of her pressure on the outside of the foot. And really the best thing for that, you can do stretches and exercises, but really the best thing for that is custom orthotics, and that's really the only thing that's going to fix that long term. Now, the orthotics can also, if you have plantar fasciitis with knee pain and hip pain, the orthotics can help not only with the foot pain, but the knee and hip pain as well in that situation. So orthotics are often missed, and sometimes the cause of low back pain, but sometimes it's misdiagnosed as a pinched nerve creating foot pain. And again, in this situation, it's just plantar fasciitis, which is inflammation of the plantar fascia right here, because it's being stretched tight because the arches are flat. So after we scan the feet, we do recommend orthotics. That's up to the patient. That's a long-term fix. In the meantime, there's a few things we can do. We can do cold laser therapy on the plantar fascia, or we can do this. And then we also have an instruct the patient to stretch their calf muscles. Her calves are not that tight. So, you okay there?
Yep, that's right.
You said one foot was worse than the other?
Yes, the right foot was worse than the left.
Okay.
Amazing.
Feels good, right?
Yes.
And do you know how to stretch your calves out?
Just like that.
That motion, which you'd stand against the wall, right? So you can stand against the wall like this and bring your foot back and put your heel flat on the floor. And I'm stretching, obviously, my left calf muscle, and then you can do your right separately. Yep. Okay, I want you to go ahead and take a deep breath in and blow out. So we're going to loosen up the muscles here because that hunched over posture does not help the hiatal hernia. It causes these muscles to get tighter in the abdominal area. So we want to loosen this up. You okay there?
Yeah.
go ahead and take a deep breath in. Bend your knees, both knees. Good. Deep breath in. And blow all the way out. Drop the legs down. Good. And again, deep breath in. And blow all the way out. Excellent. Great motion from both adjustments right there. I'm sure you felt that. How'd that feel?
That feels great.
Yeah, I'm going to have you turn over on your back. So now we're going to do the hiatal hernia move. We've done a bunch of videos on this. She's had one hiatal hernia maneuver done earlier this week, a few days ago. And how are you doing since Tuesday?
I'm doing great. Yeah.
Okay. Have you had any stomach pain since Tuesday?
No, I had a little acid reflux last night, but not
Last
too
night?
bad.
Okay.
Yeah. Not too bad.
Okay, so I'm just checking her ankles here just to make sure the range of motion's good there. That can aggravate plantar fasciitis. And we're going to go ahead and do the hiatal hernia move here. So what I want you to do is you can bend this knee and this knee here. Good. And just take a deep breath in and blow out. Good. And again. And blow out. Okay, how we doing there?
I'm good. Yeah.
And one more time. And blow out. Okay. Now, that could be a little uncomfortable. So sometimes we use cold laser therapy on over the right underneath the xiphoid and right over where the hernia is. But in this situation, I wanted to do it without the laser so you could see what it feels like. Okay.
Yeah.
So the laser helps with some of the soreness after. So you might be sore today. Okay.
Yeah, I might be a little bit, but you know, it's okay.
It's not going to be anything worse than you were feeling before. I'll assure you that. But you let me know next week when I see you. And relax yourself. There you go. Just going to check the neck here, okay? And a really gentle adjustment right here on the upper cervical spine is needed, okay? Hands up in the air. Okay, great. Come on up. So I'm gonna see you next week, okay? And let's go ahead and take a look at your foot scan closer. Okay, so here's your foot scan, and you can see this is a balanced pair of feet right here. So on this top foot, you know, the lateral arch where the green is on the outside of the foot, that's your lateral arch. The blue on the inside of the feet is your medial arch. And then that little indent right there and there, that little kidney bean shaped indent there, is your transverse arch. You want all the weight on the ball and the heel of your foot and evenly splayed across your toes. Your feet down here, you can see the lateral arch is collapsed, all the red on the outside of the foot. But look at the medial arch. See the green in there? You don't see much blue, just a tiny strip of blue. Look at that foot. That's more ideal. So your medial arch is flat, not 100%, but halfway there. Your lateral arch is completely flattened. And if you see here, you have a transverse arch there, that little indent there, and you have it on the other side. You see here, you have lateral arch collapsed on the lower foot, on your feet, and over here, we want to see green on the outside. So we don't want to see the lateral arch collapsing all the way down. There is a little bit of imbalance between the left and the right arch. The right foot is actually flatter than your left, so that makes sense as to why the right foot is more symptomatic. You got a moderate pronation score, or a flat foot score, I guess we could call it, okay?